So my name is Philipp Lurz. I'm a cardiologist at Heart Center Leipzig at University Leipzig. The device and procedure which was studied in the bRIGHT registry is the TriClip device. That's a device for transcatheter tricuspid valve repair. It's an iteration of the MitraClip device, and it's designed to treat patients with relevant tricuspid regurg who have high surgical risk and therefore are better candidates for transcatheter approaches. So this is a registry looking probably for the first time at real-world data with the TriClip system to treat tricuspid regurgitation. The patients were and are still included when they have at least severe tricuspid regurgitation and a high surgical risk. And we do exclude those patients with very high pulmonary artery pressures, and the threshold here is 60 millimeters of mercury. And the endpoints we're looking at is the primary endpoint is a successful procedure with survival to discharge and a reduction in tricuspid regurgitation of at least 1 grade. So the first analysis and presentation included 75 patients. As expected, the baseline characteristic of these patients, they demonstrate a clearly a cohort with increased risk. About 1/3 had previous left-sided heart valve surgery. About 80% were in NYHA class 3 and 4. What's interesting, and that's a little bit different to other studies, there was the proportion between man and woman enrolled in that trial was quite balanced. In the previous studies, there were more female patients enrolled, but it demonstrates that these patients are clearly at high risk. With regards to the results, procedure success was 100%. So this is very promising and reassuring, considering that in that trial, several new sites are also participating with less experience, but despite that very safe procedure, very good procedure success. And when it comes to place the clip safely into the tricuspid valve, and when looking at the first about 40 patients, there was a reduction of tricuspid regurg down to moderate in 84% of patients. So that preliminary and first analysis of the bRIGHT registry suggests that the positive results seen in the TriLuminate trial, and it was the CE mark trial, that these results can be not only reproduced across different countries and at different sites with less experience, but it actually suggests that the results in that registry are even better than in the previous TriLuminate trial. Maybe also because we now have the TriClip device in different sizes available, in a bit larger and shorter clip arms. And the next steps will be to include at least 200 patients and then keep on analyzing the results of that procedure. So the next steps will be to continue enrolling. We would like to enroll at least 200 patients, and we will keep on analyzing the data. And obviously, patients will also be followed up for a longer follow-up of up to 12 months.